Good evening, guys. I have discussion D for you. We're discussing the biggest obstacles to reducing medical errors. Okay. Are cultural, not technological. Even though medicine has advanced dramatically with sophisticated diagnostics, electrical records, and safety protocols, the system's meant to prevent avoidable harm lag behind. Because people and institutions are afraid to be honest about mistakes. The problem isn't lack of tools, it's a lack of openness. Two forces that block learning: fear of legal consequences. The page highlights that many clinicians and hospitals worry that admitting an error could expose them to malpractice lawsuits, disciplinary action, or reputable damage. This fear leads to silence, avoidance, and underreporting of mistakes instead of fostering a culture of learning. The legal environment encourages defensive medicine and secrecy, institutional secrecy. Health systems often adopt a deny and defend posture, minimizing or concealing errors to protect themselves rather than openly analyzing what went wrong. Administrators may discourage transparency to shield the institution's image, but this defensiveness prevents meaningful learning. The same errors occur, the same errors reoccur because no one feels safe enough to acknowledge them. Together, these forces create a vicious cycle. Errors are repeated because the system punishes honesty and rewards silence. What the expert is arguing, Professor Mayer Breeze, drawing on decades of patient safety work and a personal family tragedy, emphasizes that communication failures are a leading cause of medical errors. Professionals often hesitate to speak up when something seems wrong because they fear blame or retaliation. Systems without psychological safety, where staff can raise concerns without punishment, are far more valuable than catastrophic failures. Learning from mistakes requires responsibility without uh, scapegoating, focusing on systematic fixes rather than individual blame. He illustrates this with the death of his grandson, whose congenital heart defect was missed on ultrasound only after this tragedy did the system adopt universal pulse adopt universal pulse oximetry screening, a change that now saves many children each year. His story underscores how progress often comes at a cost of preventable loss. The deeper message. The headline captures the article's central thesis. When, when fear and secrecy dominate healthcare, cannot learn from its mistakes. Real progress requires cultural change, embracing transparency, accountability, and open communication so that harm leads to learning rather than silence. This is not just about protecting patients. It's about creating a system where clinicians feel safe to speak up, where institutions prioritize learning over liability, and where tragedies become catalyst for prevention rather than hidden scars. Broader implications. The argument connects to wider patient safety reforms and just culture frameworks, which stress that errors should be treated as opportunities to improve systems rather than punish individuals. It also resonates with global efforts to reduce safety or reduce preventable harm, from evasion style safety checklists to mandatory reporting systems. That the takeaway is clear. Without transparency, process stalls. Would you like me to expand this into a framework you could use in your podcast? Perhaps contrasting cultures, of secrecy with cultures of safety and showing how openness transforms outcomes. Okay, guys, that is your D for the night. I felt compelled to do this one because I believe that if you trust an institution like a hospital to treat you, they need to be open with their mistakes. When someone makes a medical mistake, they need to own up to it, be it a young person or a elderly person. This falls under a general information for people's FYI. So, with that being said, I hope this show tonight helps somebody understand, or someone who's going through this with the facility understand how to go about redirecting what you need from them: honesty, openness, things of that nature. So, with that being said, Gator Wellness, take care, folks.